What's up, everyone? We're going to talk today about how to stop your lower back from spasming. Spasms are really tough, and you're probably watching this because you have one right now, so I'm just going to get right into it. First, you want to see if there's a particular movement that you can do that makes it feel better. So sometimes that's bending forward, bending backwards, rotating side to side, or bending side to side. Those are a couple different movements that you can try. So things like child's pose, things like cobra or prone press up, things like a thread the needle, finding a position that's comfortable for you. So sometimes if you're having a spasm, lying on two pillows and just giving yourself a little bit of traction through the lower back can be really helpful. Those are just a couple different things that you can try to see if it does reduce some of the symptoms you're having. Of course, there are medications that can help. Non-steroidal anti-inflammatories, if you're cleared by your doctor to take those, can be helpful in reducing the severity of a back spasm. Some people will take muscle relaxers. Those have marginal effectiveness. Some people, they help a ton. But ideally, we're not going down that route to take those. So those are a couple different ways to do it. Another way is ice and heat. So you can use either one, whichever one feels better. And then also walking. Walking can be a great way to reduce the severity of spasms. Now, some people have more spasms with walking, so you would probably benefit more from like bending forward, doing like different stretches, going forward, stuff like that. If it's only been a day or so, then just try to stay moving as much as you can. If it's been, months or years, this is a different conversation entirely. We still need to figure out ways to get you moving, but at the same time, try to reduce the severity of the pain and the spasms. So, those are the main components of how to reduce spasms. And I mean, of course, there's massage, there's acupuncture, there's adjustments, there's all this different type of stuff that you can try, but it's really individual and you have to try things for yourself. So I've heard too many people say, well, nothing really worked. There's definitely things that do work. I haven't found somebody other than, people who have like an infection or a fracture or something who I haven't been able to help find movements that work for them. It just takes time. It can take a couple weeks. Sometimes it could take a couple months to figure things out, depending on how complex of a scenario or complex case that you might be. So it's going to be okay. Make sure to try some heat and ice first to see how that feels. See if you can go for a walk, even if it's a short one, and then see how you're feeling after a couple days. If you are still having these issues and they're pretty severe, I would and it's and it just came on randomly, it's probably not something that's super dangerous. If it came on after some sporting event, again, probably have like a muscle strain or something. Not something super dangerous in most cases. Again, if you feel like it is something that is more medically dangerous, you should definitely reach out to your healthcare provider, whether it be a physical therapist, your physician, whoever, just to give you a good clinical exam and take a good history for you, just to put your mind at ease. So go ahead and comment below if you have any questions for me related to back spasms and how to relieve them and what you have tried that's helped you. I'd be curious to know what that is. Please like this video if it has been helpful for you, and subscribe to my channel to see more videos just like this. Stay strong, have a great day, and I will see you in the next video.